Now, how big a dent has COVID left in Britain's workforce? Newsnight can reveal new analysis which estimates more than 1 million people have disappeared from the UK's workforce since the start of the pandemic, and a third of that is due to health-related reasons. The think tank, the Institute for Public Policy Research, has been investigating those factors and estimates that if the issues are not resolved, it will cost the economy £8 billion this year alone. The Department of Health says tackling health disparities is a priority, and action to reduce the gap in health outcomes will be announced later this year. Anna Collinson is here now. Can you give us some idea, more detail on what these figures actually mean and amount to?
Yeah, for sure. So researchers have looked at how many people were expected to be in the UK workforce, and they based that on pre-pandemic trends. And then they compared it with how many people are actually in the workforce now. And they found that there's 1.1 million people estimated to be missing. Now that's reflected in the big yellow bar there. Migration is one of the reasons for this, that's in the big pink bar, but the report's main focus is ill health, and that's all in blue. Now this group is made up of around 400,000 people, and as you can see, around half of them are classified as long-term sick. Now that means they may be living with long COVID, they may have mental health problems, they may be sitting on a waiting list waiting for elective surgery. Caris Roberts is from the Institute for Public Policy Research. She says looking after this group isn't just the right thing to do morally, there's also a financial argument.
So what we find is that with those 400,000 people not in the workforce, that actually leads to an £8 billion loss to our economy. Now that's because all of those people could be in work, they could be producing things, but there's also a long-term impact, because if you imagine you've been out of work for a certain amount of time, you might lose some of the skills that you had previously. You might find it harder to find your next job. So there's quite a worrying long-term impact of this loss as well.
So it's claimed the national picture only tells part of the story as well. So if you look at another graph from IPPR, the dots here, which we should see in a second, here we go, represent local authority areas in England. Now they show the correlation between household income and healthy life expectancy, which is basically the average life spent in good health. Now the light blue dots at the top represent the home counties and southern London boroughs. So if we take Wokingham in Berkshire, for example, the average income there is around £28,000, and a person there can expect to reach 71 years old in good health without a major illness. But if we compare that to the yellow dots, which is down at the bottom, that represents cities in the Midlands and on the coast. It also represents northern cities and their local and their surrounding areas. And if we take Blackpool as an example, a person there can expect to earn on average £16,000 a year and live 55 years without a major illness. So that's 8 years below the national average and 16 years below those in Wokingham.
Do you think there are solutions to this? Is there a fix?
Well, the government says a further £36 billion is going to be invested in overall health and care over the next 3 years. They promise bold action to tackle the health gap. We're expecting to hear more details about that later in the year. The IPPR has a list of ways to solve inequalities. They say, increase spending for the NHS, improve housing, better jobs, better pay. It's quite a long list, and I put it to them, it's not necessarily, or is it even realistic or affordable? But ultimately, they say that if a person can live with good health for longer, they can contribute more, which can then increase productivity. Ultimately, they argue, a healthy economy needs a healthy population.
Thank you very much, Anna.